It's 9 a.m. from Fox 35. This is Good Day Orlando.
Well, when you think of plastic surgery, you usually don't think about kids. But this little boy is making headlines around the world. The 6-year-old boy was bullied because of his ears. Well, he turned to plastic surgery to get some help. And as you can see, it made a huge difference. That's the picture of him right there on the left. But if you think this is unusual, think again. It's not that unusual. The most recent numbers show that more than 63,000 cosmetic surgeries were performed on kids ages 13 to 19 in just 1 year. And many of those were not for vanity, but to correct a physical problem. Joining me this morning to discuss this is plastic surgeon Dr. Armando Soto. Always good to see you. Appreciate you being here today.
Too,
what are your thoughts about that? I mean, you have a kid who comes to you who may be getting bullied, self-esteem issues. What do parents need to know before they do something like this to have plastic surgery for a child?
Well, the first thing you want to do is talk with your child and help them understand that, you know, all of us go through a time in life where we're a little bit different and kids are going to beat up on you about it. If they have a legitimate, you know, concern that kids are harping in on, like this young man's ears, then you want to take them to their pediatrician first, get some advice, and then get a referral to a plastic surgeon that you trust.
How often do you see? I mean, the numbers are pretty shocking for a lot of people. Yeah. Across the country, that's not a big number. Do you see it very often or no?
You know, I wouldn't say that it's really common, but it does happen. You know, what that young man had prominent ears, or ears that are you know, really unusual for a young man. Though that is you know, not unusual deformity. We do repair that quite a bit, and it's usually at around age 6.
What else do you see? Nose, I would imagine for teens,
yeah,
nose could be rough.
a lot of noses in the teen years. You know, a lot of times there'll be young women who have developmental anomalies of the breast, where one breast is much larger than the other, and that can be very socially disturbing in the teen years, so we see a lot of that too.
What are some of the issues that not only the kids, but the parents need to know about when you're getting surgery that young?
Well, I think it's important to understand the pros and cons. You definitely want to understand the appropriate timing, because depending on the body part and what the problem is, there's going to be better timing than for other procedures.
I would assume also the body's still developing, so it's not like surgery on an adult where, okay, you're done growing, right? You change something, you're done growing.
Right.
The kid's not done. Are there going to be impacts down the road too if they do get a surgery early?
Not if they get good advice and they do things appropriately. So, for example, in the story that we led with, the 6-year-old, the reason that surgery was done at age 6, even though he had probably been getting attention for his ears for a couple of years, is because the ears generally stop growing at around age 6. And so that's the right time to do that surgery.
Okay. Bottom line for parents, if they're watching this today and they do know their kid may be getting picked on, they know there's something their child's not happy about, what should they take away from this?
Well, I think that they should take away that there's help. You know, if you find the right professional, you get good advice, you can help your child overcome.
All right. Dr. Soto, what's your website in case people want to check you out?
www.drarmandosoto.com.
Always one of the best right here. Love having you on Good Day. Dr. Soto with us here on Good Day Orlando. Jamie King, take it away.